I've struggled with this my whole life. Just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Right. Good morning, Dr. Lebo Gyno. It is Friday morning, and I got this young guy. He's 23 years old, from New York, local guy, with unilateral, meaning one side gynecomastia, all gland, mainly gland, no fat. If you lift up both arms to the sky, you see this side is flat, nothing here. This side's got this big piece of meat here. The meats, Arby's meats, we got the meats. Do that, Arby's, we got the meats there. So you can see the roundness here, and this is perfectly flat. Why it happens on one side? It does. It's just during puberty, he's had it. He didn't take any steroids or any of this. At least I don't think so. He did, but he did. He says he gave me a little wink there. Yes, he took a little steroid. So this one was sensitive to whatever he took. And why that happens, who knows? It doesn't, we're going to biopsy it. And I've never seen cancer in my 40 years of doing this, never. But we always biopsy it to make sure that it's there's nothing to be worrisome about. Local anesthesia, just numb this area up. I will need a drain because this thing is so big, it's going to want to fill up with fluid, and I don't allow that. So through a stealth incision in the armpit, I'll thread a drain through there so he doesn't have an annoying scar, an annoying scar here. It'll be within the hairline of his armpit. Drain stays in about a week. And I'll make a stealth incision where the water meets the beach from the 3 o'clock to the 9 o'clock position because I got to get this mother out of here. As I said, all under local anesthesia, no liposuction because he's thin, and I don't want to ruin the normal, fat of his chest that makes him look natural, and that. So we're going to get it out to absolute perfection. I do, stand by my work. There will be never a recurrence. If he thinks there's a recurrence, we'll get him back. It could be a little scar tissue. We give him free Kenalog injections, but if it does come back, which I don't think it will ever, I stand by it, and we reoperate, but that won't happen anyway. He'll be back to the gym in 2 weeks, and let's go. That's the midline, lift up there. This is the meats, right? This big sucker right there. And again, we'll put a drain somewhere right there in the hairline, so we're gonna just numb all this area up. Grab this monster and we wipe it to us.
And he's on that side and you're going to be where, brother? Turn your head my way.
I'm going to give you a little pinch, okay?
Yeah.
Little pinch. Boom. That's it. Go slow. Alright, so I'm getting under the gland. There we go. A little twitch there because I hit the muscle.
Yeah.
Normal. Little twitch there again. I'm numbing the muscle. This thing is right. There we go. It's like attached to that muscle. No biggie. Around the side here. To the tail of it. Lift up this arm like that. I'm going to get a little bit by the armpit there. So we're going to make that hole. So this is where I'm going to put the drain in. Yeah, just numb it up. Process. Cool. And a little bit by the nipple there. A little pinchy poos. Get that all nice and numb for you. And get under the skin. Yeah, this thing is like a rock. you this gland in a minute. Get down to it. And start to get around it. This, we'll see how monster it is. Good. After that, I can see the flap I want to do. Maintain some structure to the nipple, but get the gland out. Don't if you leave a big chunk underneath the nipple, you'll be calling me in 8 years. Same time. And either I'll be still in this earth, or I won't. I will. In 8 years I will, I promise you. Unless God forbid.
Man, with my pina colada.
You got another 50 years.
Me now.
I don't know where I'll be in 8 years. It's a crapshoot.
It's a crapshoot. Okay. So, once we get that, let's just fine tune this gland here. Just see where things are.
I was talking to like somebody, one of my friends yesterday. It's been 14 years since I graduated high school.
It's been 14?
14 years.
Shit. You still speak to people?
Yeah, I still speak to some people that I went to high school with.
Okay, lift up. Watch yourself. Right, good. Yeah, that's one. Elbow straight. I want a little stretch there. Good. All right, now. That is beautiful. Get that out of the way. Good. Yeah. You can just put that right in there. Sorry about that arm being up there. I want to get a nice flat surface here. I gotta see till the bottom here. I get under it. Keep it clean. There we are. Remember I told you I want to get into that space?
Yep.
So it's like taking chicken off of a skin off of a chicken.
Yeah.
You get into that space. There we are. And you finger fracture it without hurting my finger. Good. So all the water I've done is called hydrodissection. Good. And go the other way. Maybe. Good. Okay, so once that's done, keep it on for a minute because it gives me a straightforward. This feeling I can feel these stitches, what do you call it? Scissors are an extension of my fingers. So I can actually feel. It's okay. Good. Okay, so now I got that. Good. So when that's done, I can hear that little. Who was that?
That was Dario's father.
Oh. What is he bothering us for? What, he wants to help? I was wondering. Let's come in here this time. Have him go to the bar.
Yeah. Go to Finley's. You know?
Go to Finley's. Fucking Finley's, I hate. You were probably one of the kids that peed in my back here when you were.
You know what? You may not be wrong in saying that.
Oh, yeah. All those kids, they fucking pee. They're in my back peeing. get rid of that one.
Forget about it. You catch a disease going in there.
Do you?
Oh no, it's terrible.
And how about the girls? You gonna pick up your future wife there?
Maybe.
Maybe.
Not too bad.
Not too bad.
Not too bad.
Yeah.
You gotta be, it's hit or miss sometimes.
Hit or miss.
Depends on the night.
Y'all good, my friend?
All good.
All right, so this is just getting this thing out.
So yeah.
No, I'm still fighting it. I'm still fighting it. It's gonna come. I'm just freeing it up from its attachments. As clean as I can. Always clean. I love doing videos. As I tell patients, I take extra care to make sure it's, it's presentable for the camera. So extra. Nice. It's getting there. Let's go over here. Nice.
But it was good. You want to raise the water?
No, you're perfect. Yeah.
Straighten it out, y'all.
Yes. This one? Or
Yeah,
what?
straighten it out, relax. Yeah. Perfect. Better, right?
Yeah.
So we're just working here. Sure, I don't break my fucking scissors. Yeah. Let's see what's going on here.
Everything's going perfect, man.
Yeah. Good. All right. Gotta get rid of that. Still stuck there. Nice. Getting there. You all right?
Yeah.
there. There. Good. Extravante. All right. This is the majority of it. Look.
Oh, shit.
Put that on that table now. All right, now is when I gotta clean it up and look in there and make sure that I got everything out nicely.
Beautiful. My arm was good. You were string the more.
Nope, you're fine. So now I gotta go in and fine tune it. interrupted deep stitches just right in the subdermis. Nothing in the skin. Nothing in the skin. That one close it airtight.
These are dissolvable.
All absorbable. Don't have those Frankenstein ones. See?
How long it takes to dissolve?
A couple months actually.
Really?
Yeah. They stay in for a while.
Really?
About 3 months. Yeah, they don't. They're soft. They're like silk. Yeah, you can start casting off almost everything, except for the little things that I'm using. In case I need to put it in, in case it doesn't hold air. Or add one. just yet. I'll test it after we take the photos. A leak. Gotcha, Dr. Lebo, Gyno and Beyond. We did unilateral, big, steroid-induced gynecomastia gland removal, no liposuction. And these glands indeed were huge. This is the size of the gland. The main course was right there. And then you gotta get the periphery of it. So I got out the main thing, and then perfectly I sculpted to make sure that every little bit of that gland is gone. And I double checked, triple checked, quadruple checked, everything's gone. I contoured the fat, the muscle is pristine, and this went down to the lats all the way in the sides. Because of the size of this gland, we had to put in a drain, which will stay in about a week. And he's swollen around there, but I put a liter, 1 liter, 1,000 cc's of tumescent fluid in there. And as you saw, it was absolutely bloodless. A little redness there. That's because this gland, because of the steroids, were intimately adherent to the underlying skin. So we had to make sure that that was perfect and contoured. Through a stealth incision right by the nipple, that's the closure, all internal stitches. And of course I had to drain it, and I put the drain into the hair-bearing part of the underarm, so there's no extra scar. And this drain will stay in about a week, plus or minus. So if you have gynecomastia, you want it done right, you want it done perfectly, and under local anesthesia, which is comfortable, without pain, without discomfort whatsoever, you call me, Dr. Lebo, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.